Coronavirus cases surge across the United States, with the death toll now topping 140,000. And Cuba's medical teams fight COVID-19 across the globe. Hello, I'm Arnold Naidu, and this is The Heat. There are now more than 3.8 million known cases of coronavirus reported in the United States, and thousands more deaths are expected in the next few weeks. The crisis is a major challenge for states whose hospitals are pushed to the limit as they battle the pandemic. Meanwhile, Cuba's medical teams continue to offer international aid, with their doctors and nurses helping countries fight coronavirus across the world. We will talk about Cuba's efforts later in the show, but we begin with the crisis in the U.S. Joining me now via Skype from Washington, D.C. is Gavin Macgregor-Skinner. He is the Director of Global Biorisk Advisory Council and an infectious diseases expert. With us in Washington, too, is Jason Nichols. He is a lecturer in African American Studies at the University of Maryland. And also joining us from Arizona is Will Humble. He is Executive Director of the Arizona Public Health Association. Thanks to all of you for joining us. And Gavin Macgregor-Skinner, let me start with you. If we look at the situation in the United States right now, as I mentioned, 140,000 deaths. That number is expected to go up. What is your evaluation? How serious is this? And we're hearing these alarming reports that the country may have lost control.
It's incredibly sad. Again, I want to emphasize that the SARS-CoV-2 virus that causes COVID-19 is the easiest of all the germs to kill or inactivate. We also have very simple things to prevent or slow down the transmission: washing your hands with soap and water properly, putting on a mask, keeping physical distance. If we can't do those easy things right now, then this disease is never going to go away. It's going to keep coming back. And again, the numbers we're seeing every day are just alarming.
I guess one of the problems, Gavin, is that this has become so politicized.
Isn't that unfortunate? This is what really upsets me. I work in hospitals every day. The fact that putting on and wearing a face covering over your nose and your mouth, a mask, to, again, protect people, to make it safer, to decrease the risk of getting sick, is now political on the agenda item. And I think that's just terrible. I think it's awful.
All right. Will Humble, Arizona is one of the hardest hit states. What is the situation there now?
So as you mentioned, it's been really challenging here in Arizona for the last 6 weeks, really 2 months. We've had a big run up in cases that's really put our hospital system really at the brink. And fortunately, our governor, just in the nick of time, actually a little bit too late, put in some policy interventions 4 weeks ago, one of which was allowed the cities to actually put in a face covering ordinance. He didn't want to do that statewide, but he at least began to allow cities and county health departments to make that requirement. And in exchange, what we've seen is a big uptake in folks using masks here in Arizona. So that's been an important intervention. Another is that 3 weeks ago, the governor ordered the nightclubs and bars to suspend service. They were going gangbusters. It was real like pre-pandemic behavior here in Arizona. It looked like Mardi Gras you see in Brazil or something. It was just nuts after that stay-at-home order ended. Now we've got 2 interventions in place, and we're beginning to see a moderation in the increases that we've been seeing both in cases and in new hospitalizations. So it's too early to conclude that we're out of the water, but at least you can say that things are no longer getting worse. And by that standard, I guess you could say things are getting better. And Will, are you also seeing the number of fatalities drop in Arizona? No, we are not. And so one of the things with COVID-19 is that deaths are a lagging indicator of the epidemic. So emergency department visits, that's a leading indicator. New hospitalizations and new cases, a leading indicator. What is a lagging indicator is deaths, because a person comes into the hospital, they might get transferred to the intensive care ward, they might spend a couple of weeks there, maybe be ventilated. So it takes a while for them to die. And so it's a sad way to think about it, but deaths are a lagging indicator. So even in those states like ours that may be getting a handle on new cases and new hospitalizations, they'll continue to see a surge in cases for a number of weeks afterwards, just because it's the life cycle of this virus and the etiology of it.
Jason Nichols, President Trump talked to Fox News over the weekend. He talked about the wearing of masks. This is a big issue in the country right now. This is what he had to say. Let's listen.
I don't agree with the statement that if everybody wear a mask, everything disappears. Hey, Dr. Fauci said don't wear a mask. Our Surgeon General, terrific guy, said don't wear a mask. Everybody was saying don't wear a mask. All of a sudden, everybody's got to wear a mask. And as you know, masks cause problems too. With that being said, I'm a believer in masks. I think masks are good. But I leave it up to the governors. Many of the governors are changing. They're more mask into. They like the concept of masks.
So, Jason, there were different views on the wearing of masks several months ago, but I think all the experts now agree that the wearing of masks right now will bring down the infection rate. What do you make of the president's handling of this particular issue?
Well, first let me say that he's taken Dr. Fauci completely out of context.
Yeah.
Dr. Fauci said, you know, right now, back on February, I believe it was February 28th or sometime around then, he said, we don't have to wear masks yet, but this could change at any moment. And when it changes, then we will take other measures. It obviously has progressed. It obviously has gotten to a point where every American should wear masks in order to keep themselves and others safe. And that's essentially what Dr. Fauci said. So this is looking for a scapegoat on the part of the president. He's trying to blame everyone else. We know one of the things that he's done throughout his tenure as presidency is to not take responsibility for anything. I think even him saying that the governors are the people who are going to handle this is a way of deflecting any kind of responsibility for what's going on in our country. And he had many options in order to slow the spread so that we could save 140,000 lives and also the several million infections that we have in this country. And he didn't take those because he did not take the COVID-19 pandemic seriously in the beginning.
Do you get the sense that he's now taking it seriously, Jason?
Well, I think right now he realizes that there are political costs to this. I think he realizes that there is an election that is approaching very fast, that he is now far behind in some polls as far as double digits, and he does not want to lose this election. He does not want to be seen as a loser. So I think now he's trying to act as though he's taking it seriously, and now all of a sudden he's okay with wearing a mask himself, and he's saying that it's patriotic, but he didn't say that when he could have prevented all of these infections, when he could have done this, months ago, at least by April. He could have started talking about this. He could have gotten his followers who have made this into a political issue. He totally could have prevented a lot of infection and a lot of death had he taken the right measures, at least by April.
Gavin, the other big debate taking place in the country right now is about the reopening of schools and colleges. We know that President Trump and some governors around the country have been pushing to reopen institutions. But can that be done without pushing numbers up even higher?
Yes, it can be done. I'm working on a number of committees in different states, helping them to come up with their opening plans for their schools. Again, we've got to look at where the virus is being transmitted at the community or neighbourhood level. And many of the communities now, because they're doing the right thing, they're wearing masks, washing their hands with soap and water, cleaning and disinfecting high touch points, we're seeing low transmission. Even some communities are showing no transmission. Those schools can open up. And they have to open up in a different way. There's ways we can stagger the times. There's ways that we can protect the students as well as the teachers, as well as the building. So I firmly believe that we should be working on plans to open schools up.
Will, the president is also talking about resuming those coronavirus White House briefings that we saw at the beginning of the pandemic. This is what he said on that. Let's listen.
We had very successful briefings. I was doing them, and we had a lot of people watching, record numbers watching. In the history of cable television, there's never been anything like it. So I think what we're going to do is I'll get involved and we'll start doing briefings.
So, Will, what will this do? I mean, do people want to see more of people like Dr. Anthony Fauci? I mean, if the briefings come back, and when they come back, will this underline how serious this situation is?
Well, I think it all depends on what the content is. You could say you're having a press briefing, but what really matters is what's the content? Who are the experts that are, giving the message? What messages are you giving out? Some of those press conferences were saying, I mean, there was some ridiculous things that came out of those early press conferences. And I won't repeat what some of those were because I don't want to say them again, but there were some real untruths coming out of those initially. Now, that's not to say that they're a bad thing inherently, but what really matters is that you have solid content delivered by people with authentic knowledge and who have a clear way of communicating with people. You know, we've been having a similar problem here in Arizona. Our governor has a press conference once a week. A lot of it is scripted and prepared. Much of it is not particularly useful. And so what really matters, as I'm saying, is what's the content? Who is delivering the message? What's the scientific merit of what's being said, and what are the action items that you're asking the population to take? So I think communication is a good thing, but how it's done is what makes it valuable.
Well, do you think it would help if the president makes it really clear at these briefings, these resumed briefings, that he is going to follow what the scientists say?
Well, yes, I think that would be helpful. And in order to make that happen, I think the scientists need to be the folks that are front and center. Mm-hmm. You know, one of the things that is true about the way things work here in the United States is that there's an awful lot of power that's given that the states have. The states' governors have a lot of executive power in the United States because of the way our federal system is built. And the messages that come from the president are very keenly listened to by our governors. And I think that is one of the critical control points that is missing here, is that the governor is in many ways intimidating or influencing governors in ways that are unhelpful, whereas I think it would be better if he would just stand back and not try to influence governors, to be honest with you, because most of the time what I've seen is that when the governors or when the president influences, usually a Republican governor, they tend to make worse decisions. And so, you know, I think this communication thing is really critical, but it's not all, you know, the blame doesn't go just to the president. Mm-hmm. These governors need to be making more evidence-based decisions within their own states. And I think they are being unduly influenced by the governor, but by the president, but that's their own fault.
Jason, some very influential people in the White House who were there in the early days of the Trump administration, people like Corey Lewandowski, Steve Bannon for another, they left the administration or were pushed out, but now they are making a return. What does that tell us?
I think it tells us that the president is actually in trouble. I think he's bringing Corey Lewandowski back, and he's bringing in Steve Bannon and all these people because he believes those are the people that got him elected the first time. It has nothing to do with COVID-19. This is about messaging. This is about gathering up his base. And he realizes that these people are in touch with the base. They understand, you know, the angst, the frustration that comes particularly from white working class voters. So he's trying to gather up the old team, realizing that they had the recipe for success the first time, but because of him, in part, America's a very different place right now. We are in a different place with the pandemic. We're in a different place in terms of race relations. And I'm not sure that Corey Lewandowski, who I know personally, if he's going to have the answers for the current political climate and with how far the president is falling behind in this election.
Gavin, one other development, 3 vaccine trials showing some promise, and we are also getting some good news about treatments. Are you hopeful we could have something before the end of the year?
I'm not sure that it'll be before the end of the year. I'm really impressed with the data that I'm seeing it right now for the research on these vaccine candidates. I want to just reflect, though, that, you know, this would be the first time that we've developed a vaccine against the coronavirus. I'm also seeing a bit more better information, better data coming out on the immunity related to T cells. So again, as we move forward, again, there's lots of research being done. People are working really hard. Do I think it's going to come out at the end of the year? No, I don't. I think there's still quite a bit of work to be done, but I think we'll have something by early 2021.
And very quickly, Gavin, these vaccines, the development of these vaccines, they require human trials, don't they?
Oh, and a sequence of trials.
Yeah.
Well, the first thing to do is, are they safe? And then after you prove they're safe, then you'll work out, do they actually work? Are they effective? So it takes quite a while to get those vaccines from the research stage to the distribution to the public stage.
Well, very quickly, I've only got about 30 seconds. The key to beating the virus, as we've seen in other countries, is testing and tracing. Should the US be doing more in that regard?
Well, yes, I think, well, here, as I mentioned, there's 50 different responses that are happening here in the United States. And in the states where you see the big run-up in cases, at the core, I think what you see is that the virus gets out of control, and then the testing capacity is inadequate. So you have this linear increase in testing and an exponential growth in the demand for the test, and that's the real problem.
Okay, and that's where we have to leave it. Thanks to all of you. We turn now to Cuba and the major international contribution the island nation is making to fight coronavirus around the world. Cuban medical teams have deployed to several countries since the pandemic began. Hundreds of its doctors and nurses have come to the aid of countries from Latin America to Europe. In March, Cuba sent a medical contingent to Italy when it was at the epicenter of the COVID-19 crisis and in dire need of assistance. Cuban medics have also traveled closer to home, like Martinique in the Caribbean islands, and Cuban doctors and medical experts have helped fight coronavirus as far away as South Africa.
Well, my spirits were lifted last night when I heard that 219 Cuban health workers had landed in our country. This follows the request I made to the president of Cuba when the coronavirus was beginning to rear its head in our country, and I asked the Cuban government to send us their specialists.
And to discuss all of this, joining me now from a windy Havana is Christina Escobar. She is a journalist and commentator. Christina, great to have you with us.
Thank you, my pleasure.
Now, this is a major international effort by Cuba. It's been deploying its medical teams, doctors and nurses around the world. How many countries has Cuba helped, and what kind of expertise is Cuba sending to these countries?
Well, Cuba has a long history of helping other countries, essentially in circumstances of disasters, pandemics, earthquakes. It has happened in many countries in the world. But now, with the COVID-19 specifically, Cuba has sent brigades to 27 countries in Africa, America, in our entire continent, and also in Europe. All of them at the request of these authorities, of these governments that have asked for the help of Cuba, due to the fact of the long experience that Cuban doctors have in tackling these sort of pandemics. Just 5 years ago, Cuban doctors were sent to Africa to fight the Ebola outbreak. As a matter of fact, they were awarded by the WHO in 2017. This is a group of doctors extremely well trained in circumstances of disasters and specifically in epidemics. But right now, 27 countries just received only for COVID-19 tackling this pandemic that is hitting the entire world.
Right, actually, a Cuban medical team was sent to Italy in March at the time when Italy was at the epicenter of the pandemic. How did Cuba end up sending its medical team to one of the richest countries in Europe, and what was that mission about?
Well, in the case, for example, of Italy, the Cuban government answered to a request from the Lombardy, which was the epicenter of the outbreak, authorities. Those authorities asked for the help of Cuba. And it's true what you say, it's one of the richest countries in the world. Cuba is a developing country with a lot of struggling economically. But we've seen in this pandemic that it's not about big economies or not. We're seeing the biggest economy of the world struggling very badly with the pandemic. And you see that it's not about the money or the size of an economy. It's more about how the health systems are actually able and capable of dealing with this enormous challenge that is a big problem for all over the world. In Lombardy, it was a request of the local authorities. All the doctors there were sent to the red zones, so they were actually in the red zones treating patients and saving a lot of lives. It's part of a political will of the Cuban government to do this. It has been for years now, the fact of sending doctors and also receiving young people to study medicine here in Cuba. It's a two-way idea. And definitely, a lot of people might be wondering, why would Cuba, a small country, developing country, heavily sanctioned by the U.S., is sending doctors to such a big country? Well, as a matter of fact, they asked for it, and the doctors are well trained, and they can be useful there. And it's a matter of solidarity. The Cuban government, at least that's what they say, is not making money out of specifically to this brigade in Lombardy.
Right, and Cuba also provided help to South Africa, and of course that's not something new. Cuba also helped South Africa fight the apartheid government. It gave South Africa military help. It gave South Africa diplomatic support as well. South African President Cyril Ramaphosa, he's been talking about the aid that South Africa has been receiving from Cuba. Let's listen to what he had to say.
This is a continuation of the wonderful relationship that President Mandela forged with President Fidel Castro.
To what extent, Cristina, is this help, like we see the help going to South Africa, part of Fidel Castro's legacy? Because he had a commitment to helping countries, developing countries at that time.
It is definitely related to a legacy of Fidel Castro. He had a huge idea of sending an international solidarity perspective in many ways, receiving people essentially from Africa to study here and from Latin America, and also sending doctors. And interesting, these brigades are sent all over the world, are called Henry Reeve, and this kind of brigade, this type of group of doctors, which are highly trained, they know languages, and they're trained in this kind of pandemics and disasters situations. This brigade specifically was created in 2005 to help the victims of the Hurricane Katrina in the U.S., Louisiana. Of course, Washington denied this help that Fidel Castro offered, but since then the Henry Reeve has become this sort of brigade that is going all over the world. They went to Pakistan where the earthquake, where there's a flood. So it's a very common thing. And of course, in Africa, there's a long story of sending doctors. There's a long history of close relations, essentially with countries like South Africa, and a close friendship between Nelson Mandela and Fidel Castro. This is something that remains, although the late former President Castro is no longer alive and is no longer in charge. But this is a sort of policy that stays on in Cuba nowadays.
And Cristina, not everybody is happy with what Cuba is doing. The United States has been urging countries not to seek or accept help from Cuba. The United States says that Cuba is using its doctors and nurses to make money for the country. How does Cuba respond to that?
Well, in many voices, the government has been very clear. These are lies. These are part of a campaign to discredit the international image of Cuba. There's no evidence of saying, for example, that doctors in these countries are creating networks of intelligence. This is all a narrative. This is a narrative that has been echoed by other governments and essentially by Western media. That's what the government has said many times, and a lot of doctors as well. The idea that they repeat a lot is that the government keeps a lot of the money that they make. Not all of these brigades that are sent away make money. This is not only the opportunity for business. The profit side of this is not in the majority of the groups that are sent all over the world. This is not the case right now with COVID-19. So the idea is that these doctors go there voluntarily. This is not something forced. This is something that they choose. They can go or not. And then obviously the government stays with part of this money. These are conditions that doctors accept. And this money is sent to take care of a huge health attention system, which as a matter of fact has successfully tackled the COVID-19. Today there's no cases in Cuba confirmed. The first day since the beginning of the pandemic. Today is the first day without any case confirmed after 3,000 tests in the country being made. So this is not new. The United States is trying and is extremely enforced now with Trump administration to say that Cuba is negative, is hell on earth, and this is part of this narrative, and it's important essentially because going against these kind of missions, of medical missions, is very effective for them, because medical missions is a way of showing that Cuba is a country that helps others. It has a diplomacy approach, a diplomacy profit in this regard, and as a matter of fact, it has an actual income. The country makes an actual income for some of these missions, like for example in Qatar and in other countries that do pay for this help. So the U.S. government, which is one of the more hostile governments in the history of the U.S.-Cuba relations, is also going against this. This is a battlefront, and of course the Cuban government has been very clear saying that these are lies. There's no evidence of any of this, and of course I don't see this kind of controversy disappearing anytime soon.
What kind of impact is the coronavirus pandemic having on the Cuban economy, especially its tourism sector, which is pretty important for the country?
Well, the heat it's been quite hard, essentially because Cuba depends on foreign tourism to make money. A country which is, as we've said, heavily sanctioned by the U.S. Using U.S. dollars internationally is very hard for the country. It's very hard to find banks that are able to do that. At the same time, all the shipments of oil shipments from Venezuela has been followed and fined and make it harder from the U.S. Government. So the situation, there was a crisis before COVID-19 hit this island already. There was an economic crisis, and obviously now it's hotter. And what I think the good side of that, of this situation, is that the government is just announced a series of changes and a series of important steps towards giving more power to the enterprises, giving more power and more room and flexibility to the private sector. So these are changes that are pushed by the fact that you need to do something different to actually have a different outcome. And this is extremely important in a situation of tension. This is extremely important. It's been over $1 billion it has cost to actually tackle the COVID-19 in this country. So this is money that was not planned to be spent, and definitely there's a huge tension. On the streets, there's a shortage of pretty much everything, long lines for a lot of for buying food, although there's a subsidized group of food that you can receive every month. Every Cuban does receive this, but the situation is quite tense economically speaking, and it will be like this for the government and also for the small businesses, taking into consideration that a lot of small businesses live out of what the tourism brings. And to recover, to see this recover, is going to take a while. Essentially, like for example here where I am here in Havana, the big income was about cruise ships that got here every week, and people walked around these streets and used the private services, the private sector kind of services like cars or small restaurants, and this is absolutely gone, and it will be gone for a while. So it's definitely a very complicated situation right now, and that's why the government is taking other steps and it's being more creative, and this is something that wouldn't have happened without the pandemic. This is extremely important. This could be the silver lining of this situation, is the fact that this tension, this economic tension, is pushing other changes that in other circumstances wouldn't have happened. But definitely it's a big hit, like it has been for the entire world, but this country, depending heavily on dollars and extremely sanctioned by the US, is definitely going through a hard moment.
Cristina, thanks so much for being with us. And we need to leave it there. I'm Arnold Naidu. Thanks for watching.